Hi, my name is Dr. Stephen Vath. I'm a board-certified plastic surgeon at the Center for Cosmetic Surgery with 2 locations in Denver and Golden, Colorado. So what is a facelift? There's a lot of misconception about what a facelift is. A full facelift, a mini facelift, or many of the other names that are given to facelifts. First of all, anything with the name facelift in it from the plastic surgery standpoint is a spin on a very similar operation. There are subtle twists to each procedure, which plastic surgeons will adopt and find a preference for, but otherwise, these are very similar operations. People come in with complaints about their nasolabial fold up near the nose, something about their cheeks, maybe something up near their eyes or brow, and think that a facelift might be the answer. Facelifts specifically address 2 areas, and in my opinion, 2 areas exclusively, which is the jawline and the neck. The way a facelift works is you're making an incision around the ear, which goes in a woman behind the tragus, which is this cartilage, so it's a very hidden scar, and wraps around the ear back here. And there are different ways to execute this incision and therefore the scar pattern. So there are many different types of facelifts. The mini facelift is a facelift where you are addressing the same areas, the jawline and the neck, but generally doing it through a slightly shorter scar and a scar with a different location. The location of the scar at the hairline, as opposed to going up in the hair, allows us to avoid loss of the hair-bearing area here and loss of your sideburn. If you lose your sideburn, it's very counterproductive to trying to look younger. If you lose your sideburn, you actually look older because you're bald right here. So what's been changed with the mini facelift over the last 20 years actually is that the incision is generally made right at the hairline. People wonder, does that make the scar look more noticeable? Absolutely not. When the scar is right at the hairline, you don't see it, you don't affect the hairline, and you keep your youthful sideburn so that you look like you have a normal appearing hairline. And then in the back, we can generally keep the scar shorter than was traditionally possible, still doing all the same work underneath. So what's going on with a facelift is you're actually lifting the skin and going underneath to tighten up the deeper layers in the face and the neck. Once you tighten up the deeper layers, the skin overlaps the ear, you remove that extra skin, and you sew it together in such a way that the scars are inconspicuous. Sometimes when employing the mini facelift, I add what's called a platysmoplasty. And a platysmoplasty is where you put a small incision underneath the chin. It's very well hidden, and it allows you to add some tightening of the muscles in the neck as well as some liposuction underneath the chin. This is for certain situations depending upon your type of neck, and I apply this selectively depending on if you need it or not. There are plastic surgeons which will add that part of the procedure to every facelift, and that is a reasonable way of approaching facelift surgery. But in my opinion, there are many people that don't need that extra incision and can have an excellent result with just the scar around the ear.